7 alarming signs your blood sugar is too high. People with diabetes frequently have high blood sugar, also known as hyperglycemia. But even those without the disease can experience blood sugar spikes brought on by the accumulation of glucose in the circulation. This is why it's important to recognize the main signs of high blood sugar as soon as possible. However, before we discuss the main signs, let's first understand how glucose is produced. We obtain glucose from the food we eat. For our organs to work correctly, our body requires glucose to enter our cells and transform it into energy. This is where insulin comes in. Without insulin, glucose will simply build up in our bloodstream and cause life-threatening conditions like diabetes. Insulin is a hormone that the pancreas produces that permits glucose to enter our cells. Not all blood sugar rises are indications of diabetes, though. Therefore, we'll show you 7 signs of high blood sugar in this video, along with 5 typical diabetes symptoms. Please note that everything in this video has undergone evaluation and review by certified healthcare professionals. If you are here for the first time, do well to click on the subscription button to get more educative information on how to live a healthy life. 7 alarming signs of high blood sugar and 5 diabetes symptoms. Number 1. Weight gain. A prominent indication that your blood sugar levels are too high is weight gain. A significant amount of abdominal fat may be caused by insulin resistance. Again, this alone is not a sign of high blood sugar, but if it is present together with other symptoms, you should be cautious. Therefore, living an unhealthy lifestyle that involves eating junk food and staying in bed all day may result in weight gain, which can then contribute to high blood sugar. This indicates that you are feeding your body far more glucose than it can utilize, causing the glucose to build up in your bloodstream. Therefore, be careful to maintain an active lifestyle throughout the day and monitor your weight. Number 2. Excessive thirst. Your kidneys work overtime to eliminate the extra glucose in your circulation. As a result, they keep requesting more water so they can generate more urine and assist your body in eliminating sugar. Therefore, increased thirst will result in frequent urination. In addition, your body will suck water from your tissues because it is trying to get rid of all that sugar, which will make you feel dehydrated all day. You should visit a doctor to have your blood sugar levels checked if this increased thirst lasts more than a few days. A symptom of diabetes may be excessive thirst. Number 3. Excessive urination. Urinary tract infections, which can cause excessive urine and wake you up in the middle of the night to use the restroom, can occur in people with high blood sugar levels. Urinary tract infections can also cause a desire to urinate despite having an empty bladder and pain or a burning sensation when urinating. Additionally, they could cause lower abdominal and pelvic cramps, as well as bloody urine. Of course, there are other causes of urinary tract infections, so if this is the only symptom you are experiencing, you shouldn't be concerned about high blood sugar levels. Visit a doctor instead, and get the infection treated before any additional concerns arise. Number 4. Weak immune system. A weakened immune system makes infections more likely to affect people with high blood sugar levels. The physical barrier of our skin and mucous membranes serves as the first line of defense for our immune system. The second line of defense is the innate immune system, which responds to any pathogens entering the body with a short, non-specific immune response. The third line of defense is the adaptive immune system, where a large number of white blood cells get ready to fight any viruses and pathogens that may have moved past the first 2 lines of defense. High blood sugar and diabetes in particular can impact the nerves and limit blood flow, increasing the body's exposure to certain infections. Get your blood sugar levels examined if you notice that even the slightest wounds and bruises take longer to heal than usual. Liking our video and health tips so far? Before we move on to the next signs, don't forget to hit the like button and subscribe to our channel so you never miss out on our new informative videos. Number 5. Blurry vision. When you have trouble focusing your eyes and can't tell apart small details in what you're seeing, you have blurred vision. Of course, myopia can also cause blurry vision. However, it can also indicate high blood sugar levels if paired with some of the other symptoms mentioned thus far. So, you should go take care of it. Don't overlook these symptoms, since diabetes can potentially develop into more severe retinopathies that can even cause blindness. Number 6. Fatigue. Your body will work to remove glucose when your blood sugar levels rise above milligrams per deciliter. Additionally, because your pancreas is unable to create enough insulin to convert glucose into energy, you will struggle to focus on specific tasks and experience all-day fatigue. This can also occur as a result of diabetes or blood sugar increases. You should visit a doctor if the symptoms persist or worsen over time. It could be a symptom of diabetes. Number 7. Abdominal pain. The presence of non-diabetic hypoglycemia may also cause abdominal discomfort. Bloating, cramping, nausea, and even vomiting are side effects of consuming large amounts of sugar. Consult a doctor if you don't already have diabetes but have a family history of it and frequently experience hyperglycemia. You can determine if you have diabetes with a straightforward hemoglobin A1C test. A glucose monitoring kit is also available to help you monitor your blood sugar levels at home. Diabetes should not be taken lightly. You should constantly be sure to have your routine health examinations because they can happen to anyone at practically any age. If 2 or more of these 7 blood sugar levels appear frequently, it may be an early indication of diabetes. This is why it is important to watch out for these 5 diabetes symptoms. 5 typical diabetes symptoms. Number 1. Constant hunger. People who have diabetes can't obtain enough energy from their diet because their bodies don't create enough insulin, which means they can't convert glucose into energy. Our digestive tract converts the food we consume into glucose. Our pancreas generates insulin, a hormone that converts glucose into fuel for our cells and organs. Diabetes occurs when our body is unable to convert glucose into energy due to a shortage of insulin. Furthermore, if you have insulin resistance, you will seek carbohydrates and sweets. Giving in to these urges will cause our blood sugar to increase. Number 2. Tingling and numbness in the hands and feet. Diabetes can cause the body's natural blood circulation to become obstructed by high glucose levels. Additionally, studies have shown that if blood sugar levels are not controlled, they can harm neurons, reducing their capacity to deliver messages to all of the extremities. Unfortunately, unchecked, high blood sugar levels can also damage the walls of the blood arteries that carry vital nutrients and oxygen to the body's cells. As a result, your hands and feet may start to tingle and feel numb. Visit a diabetic expert if you have these symptoms, in addition to other hyperglycemia warning signs. Number 3. Mood swings. Like estrogen, testosterone, hunger hormones, etc., insulin is a hormone that is naturally released. As we've seen thus far, insulin plays a role in controlling the blood's glucose levels. However, when insulin levels are low, hindered, or eliminated, the body experiences a hormone imbalance. This may also result in erratic moods, harsh emotional outbursts, or even depression. Additionally, these mood fluctuations may trigger desires for a variety of harmful comfort foods or sweets. These hormone imbalances may cause havoc in the body, making you feel hungry, irritated, or depressed. Number 4. Dark skin patches. Diabetes can cause a variety of skin issues. First and foremost, there is diabetic dermopathy, which manifests as little brownish patches on the skin, particularly on the legs. According to a study, they can occur in around 55% of diabetic people. You may also see dark, smooth skin on the back of the neck, armpits, or groin, which indicates insulin resistance. These black skin patches are known as acanthosis nigricans, and they are among the first signs of diabetes. Number 5. Yeast infections and itching. Excess sugar in the blood and urine can also result in yeast infections. The increase in sugar will provide optimal conditions for yeast to grow. especially in the armpits, mouth, and genital areas. A 2013 study on women showed a significant link between type 1 diabetes and vaginal infections. Itching, burning, pain, and redness often accompany the infections, along with other symptoms. Since yeast grows because it feeds on sugar, having high blood sugar levels will result in yeast overgrowth. Therefore, if you have noticed any of these symptoms, we encourage you to get medical attention. With the correct medication and a few lifestyle adjustments, early-stage diabetes can be managed. It's important to consume nutritious meals and exercise regularly. If you found this video to be helpful, kindly click the like button and subscribe to our channel.